A client admitted in the coronary care unit, CCU, has developed atrial fibrillation. The ventricular rate is at 155 beats per minute. The nurse should assess the client for A. Flat neck veins. B. Hypertension and headache. C. Nausea and vomiting. D. Hypotension and dizziness. Answer. D. Hypotension and dizziness. Rationale. A client with atrial fibrillation, AF, who develops a ventricular rate of 150 beats per minute or more may have loss of atrial kick. This can result in low cardiac output, which can manifest as hypotension and dizziness. In addition, the nurse should assess for palpitations, chest discomfort or pain, distended neck veins, shortness of breath, fatigue, and syncope. 2. A nurse is caring for a male client admitted in the CCU due to cardiac dysrhythmia. While the nurse delivers personal care for him, the patient suddenly develops ventricular fibrillation. After calling for help, the nurse should immediately A. Administer intravenous sodium bicarbonate. B. Initiate CPR. C. Defibrillate the patient. D. Administer oxygen. Answer, C. Defibrillate the patient. Rationale. Ventricular fibrillation, VF, is a type of fatal dysrhythmia that requires immediate defibrillation. Once VF is identified, the nurse should deliver a shock of 120 to 200 joules using a biphasic defibrillator, or 360 joules using a monophasic defibrillator. The nurse working in the CCU would be able to initiate defibrillation on a client with VF, as this is usually a standing order in this unit. 3. A client diagnosed with folate deficiency anemia is being discharged. The nurse should primarily recommend which of the following foods to the patient. A. Meats and dairy products. B. Green leafy vegetables. C. Eggs. D. Whole grains. Answer. A. Meats and dairy products. Rationale. Folate deficiency anemia involves the lack of vitamin B12 or folate. Meats and dairy products are the best sources of vitamin B12 for a patient with folate deficiency anemia. Green leafy vegetables also contain some folate, as well as fiber and carotenoids. Whole grains contain thiamine, while eggs are rich in iron. 4. A client is admitted with suspected pernicious megaloblastic anemia. The laboratory results are now reported. Which of the following findings confirm the diagnosis of pernicious anemia? A. RBCs of 5.5 million. B. Elevated Schilling's test. C. Sedimentation rate of 17 mm per hour. D. Gastric assay shows absence of intrinsic factor. Answer. D. Gastric assay shows absence of intrinsic factor. Rationale. Pernicious anemia is characterized by a lack of the intrinsic factor due to the atrophy of the stomach wall. This results in the failure in absorbing vitamin B12 in the small intestines. Vitamin B12 is needed for folic acid to undergo DNA synthesis of red blood cells, RBCs. Analysis of gastric juice or gastric assay is an important diagnostic test to confirm pernicious anemia. 5. The doctor orders cardiac catheterization for a client admitted in the CCU. The procedure will involve the use of a radiopaque dye. The nurse is aware that the most important part of the pre-procedure assessment is checking A. Allergy to iodine or shellfish. B. Height and weight. C. Baseline peripheral pulse rates. D. Intake and output. Answer. A. Allergy to iodine or shellfish. Rationale. Clients who are allergic to iodine or shellfish are at a higher risk for developing an allergic reaction or anaphylaxis to the iodine in the radiopaque dye. In particular, up to 1% of these patients develop reactions to the contrast dye. Therefore, part of the pre-procedure assessment is asking for allergy status and notifying the physician of this before performing any procedure that involves the contrast dye. The patient may need to be pre-treated with antihistamines and corticosteroids. 6. A female client admitted in the coronary care unit, CCU, due to myocardial infarction has stabilized and is moved with a cardiac monitor via telemetry to the step-down medical unit. The nurse in the medical ward informs the patient that she can perform which of the following activities. A. Walking in the hallway unsupervised, with distances under 200 feet. B. Strict bed rest for 24 hours. C. Any activity as long as she is attached to the cardiac monitor. D. Self-care activities and bathroom privileges. Answer. D. Self-care activities and bathroom privileges. Rationale. The patient is allowed to perform self-care activities and have bathroom privileges upon transfer from the CCU to the general medical unit. She should be supervised when ambulating with gradual increases in distances, up to 200 feet. Since the patient is on cardiac monitor via telemetry, she should be visualized on an hourly basis. The nurse should also assess the patient with every ECG alarm. 7. A client is diagnosed with deep vein thrombosis, DVT, and requires IV heparin therapy. While the patient is having this infusion, the nurse should ensure that the nursing unit also has which of the following medications: A. Potassium chloride. B. Protamine sulfate. C. Aminocaproic acid. D. Vitamin K. Answer. B. Protamine sulfate. Rationale. Protamine sulfate is the specific antagonist or antidote to heparin. It must be available in the nursing unit to counteract any hemorrhage or excessive bleeding due to intravenous heparin use. Protamine is able to neutralize anticoagulation from administering heparin. Vitamin K is the antidote for warfarin. Aminocaproic acid is an antifibrinolytic agent, while potassium chloride is used to manage hypokalemia. 8. An anxious client comes into the emergency room with signs and symptoms of coronary artery disease, CAD. The nurse understands that the first priority of care for this patient is to A. Perform health education about the symptoms. B. Administer a stat dose of nitroglycerin sublingually. C. Attempt to decrease anxiety level. D. Improve myocardial oxygenation. Answer. D. Improve myocardial oxygenation. Rationale. A client that exhibits signs and symptoms of any cardiac problem must receive immediate care to improve myocardial oxygenation to prevent, reverse, or reduce any damage to the myocardium. This can be achieved by the reduction of ventricular stress using negative inotropic agents, such as beta blockers and calcium channel blockers, as prescribed by the physician. The other options are also important parts of caring for a CAD patient, but resolving the problem with an ischemic myocardium takes the highest priority. 9. A nurse performs a health education session about myocardial infarction on a high-risk client group. Which of the following should the nurse state is the most common symptom of myocardial infarction? A. Dyspnea. B. Chest pain. C. Palpitations. D. Edema. Answer. B. Chest pain. Rationale. Chest pain is the most common symptom of myocardial infarction. It occurs due to the low supply of oxygen to the heart, resulting in myocardial ischemia. Myocardial infarction chest pain usually radiates to the left neck, shoulders, or arms and has no apparent precipitating factors. It often lasts for 20 minutes or more and is usually retrosternal. The patient may describe myocardial infarction chest pain as a sensation of heaviness or a pressure. It can be persistent or intermittent and is not affected by changes in position. The second most common symptom of myocardial infarction is dyspnea. Palpitation is a sign of arrhythmia, while edema is a late sign of heart failure. 10. A male client comes into the medical assessment unit with a complaint of knife-like chest pain. Upon interview, the patient rates the chest pain as 7 to 8 out of 10 at rest. He states that the chest pain worsens during inspiration. Which of the following body systems is the most probable origin of this pain? A. Pulmonary. B. Cardiac. C. Musculoskeletal. D. Gastrointestinal. Answer. A. Pulmonary. Rationale. Pulmonary pain is usually sharp, sudden, and can also be described as knife-like. Some conditions of the lungs that may cause pulmonary pain include chest infection, pulmonary embolism, pleurisy, pneumonia, and asthma attack. Cardiac pain feels more of a pressure, heaviness, or tightness in the chest area. Musculoskeletal pain increases with movement, not breathing. Gastrointestinal pain such as due to acid reflux does not change with breathing. 11. A client exhibits signs and symptoms of acute heart failure. Which of the following blood tests is primarily used to detect cardiac damage? A. Complete blood count, CBC. B. Creatine kinase, CK. C. Lactate dehydrogenase, LDH. D. Troponin I. Answer. D. Troponin I. Rationale. Troponin I is the most indicative of cardiac damage out of all the four options. The levels of troponin I rapidly increase within 1 hour of cardiac injury. When a cardiac muscle is damaged, troponin spills into circulation. CK levels are also used to detect cardiac injury, but could also be deranged CK levels as a result from other conditions such as kidney disease, rhabdomyolysis, and some medications. 12. A patient shows signs and symptoms of acute myocardial infarction. The physician prescribes a stat dose of morphine. The nurse understands that the main purpose for giving morphine to this client is to A. Reduce the anxiety levels. B. Alleviate the chest pain. C. Lower the oxygen demand on the myocardium. D. Initiate sedation of the patient. Answer. C. Lower the oxygen demand on the myocardium. Rationale. Morphine can be administered on a patient with myocardial infarction primarily to reduce the myocardial oxygen demand, which then results in decreased blood pressure, heart rate, and venous return. Morphine may also alleviate the pain, cause sedation as it is a potent opioid. All these can cause a reduction of the patient's anxiety levels. 13. The physician orders an arterial blood gas, ABG, analysis for a patient with COPD and exacerbation. The nurse performs an Allen's test prior to drawing the blood to ensure that which of the following circulation is adequate. A. Carotid. B. Femoral. C. Ulnar. D. Popliteal. Answer. C. Ulnar. Rationale. An Allen's test must be done to check the adequacy of the ulnar circulation prior to puncturing the radial artery and collecting blood for ABG analysis. Taking the radial blood without checking ulnar circulation may lead to severe ischemic damage to the hand if the radial artery is injured. 14. A client who underwent a recent ileostomy procedure is admitted to the gastrointestinal unit. Which of the following acid-base disorders is the client most at risk for? A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Respiratory alkalosis. Answer. B. Metabolic acidosis. Rationale. Clients with ileostomy or enteric drainage tubes are at high risk for metabolic acidosis because they may lose intestinal secretions which are high in bicarbonate, an alkalotic substance. Patients who suffer from diarrhea are also at risk for metabolic acidosis due to the same reason. 15. A female client presents with a productive cough and is suspected to have a respiratory infection. When obtaining a sputum sample from the patient, the nurse must instruct her to perform which of the following actions? A. Take 3 deep breaths. B. Spit into the container. C. Obtain the sputum sample after eating. D. Limit fluid intake. Answer. A. Take 3 deep breaths. Rationale. The client should be instructed to take deep breaths and then cough into the sputum collection container. She must not spit into the container as this may result in more saliva in the specimen and may cause a false negative result. Rather, the client must cough hard into the container. The specimen is ideally taken upon waking up in the morning, before eating or drinking. Rinsing the mouth is also ideal to prevent contamination. 16. A nurse is performing a health teaching session about pneumonia in the community. The nurse informs the group that the organism that most commonly causes adult community-acquired pneumonia is A. Staphylococcus aureus. B. Streptococcus pneumoniae. C. Klebsiella pneumoniae. D. Haemophilus influenza. Answer. B. Streptococcus pneumoniae. Rationale. Streptococcus pneumoniae is the most common cause of community-acquired pneumonia or CAP in adults worldwide. 95% of all the cases of pneumonia were caused by S. pneumoniae prior to the era of antibiotics. In the advent of antibiotics and preventive health measures, S. pneumoniae now causes about 27% of pneumonia cases globally. 17. A 45-year-old male client with a diagnosis of chronic pancreatitis is admitted in the gastrointestinal unit. The nurse checks the laboratory results and finds which of the following serum amylase levels as indicative of the patient's diagnosis. A. 200 units per liter. B. 120 units per liter. C. 30 units per liter. D. 150 units per liter. Answer. A. 200 units per liter. Rationale. Chronic pancreatitis exhibits an increase in serum amylase levels but does not exceed 3 times of the normal value. The normal range for serum amylase level is 25 to 151 units per liter. Options B, C, and D are all within normal limits. While option A, 200 units per liter, is indicative of chronic pancreatitis. On the other hand, acute pancreatitis involves the rise in serum amylase levels, which is rapid and may go past 5 times the normal value. 18. A nurse is about to administer a bolus tube feeding via nasogastric tube. Prior to the procedure, the nurse checks the residual amount and finds it to be 170 milliliters. Which of the following nursing actions is appropriate in this scenario? A. Proceed with the tube feeding after instilling all of the residual amount into the tube. B. Elevate the head of the bed at least 45 degrees, wait 10 minutes, and then administer the feeding. C. Hold the feeding and notify the physician and dietitian. D. Continue with the tube feeding after discarding the residual amount. Answer. C. Hold the feeding and notify the physician and dietitian. Rationale. Residual gastric amounts of more than 100 milliliters indicate that the feeding must be put on hold. The dietitian must be informed of this delay in feeding, and the physician must also be informed to further assess the cause of delayed gastric emptying. The residual gastric amounts are measured every 4 to 8 hours, depending on the prescription of the dietitian. 19. A nurse has just finished inserting a new nasogastric tube to a patient suffering from severe dysphagia. Which of the following pH values indicates that the tube placement is correct? A. 7.5. B. 3.0. C. 5.5. D. 6.0. Answer. B. 3.0. Rationale. One of the tests to verify NG tube placement is called pH testing. The normal pH level is between the gastric contents tend to be acidic, so the pH value of the gastric aspirates must be 3.5 or lower. Out of all the choices, option B, 3.0, is indicative of acidic gastric aspirate. 20. A 50-year-old male patient with esophageal varices returns to the ward following an insertion of a Sangstaken Blakemore tube. Which of the following items must be available at bedside at all times? A. Irrigation set. B. Obturator. C. Sterile scissors. D. Kelly clamp. Answer. C. Sterile scissors. Rationale. A Sangstaken Blakemore tube is indicated for patients with uncontrolled bleeding to control hemorrhage temporarily. If the gastric balloon ruptures and the tube entirely moves upward, the nurse can cut the balloon lumens using a pair of sterile scissors. The client may also benefit from having a saline irrigation set at the bedside, although this does not take priority over ensuring that a pair of scissors is at hand in case of a balloon rupture. A client with tracheostomy, on the other hand, requires an obturator and a Kelly clamp at bedside. 21. A client who has recently returned from a tour in a developing country is diagnosed with hepatitis. The physician reckons that the patient has contracted this infection from eating contaminated food. Which of the following types of hepatitis is most likely the cause of the infection? A. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Answer. A. Rationale. Hepatitis A is a type of hepatitis infection that is transmitted via the fecal-oral route. Contaminated food or infected food handlers may transfer the virus to other people if they contaminate the food, water, or objects with their fecal matter. Hepatitis A is common in developing countries due to lack of sanitation and poverty. Hepatitis B and D are usually transmitted parenterally or sexually through body fluids, such as blood or blood products. Hepatitis C is commonly transmitted through sharing of contaminated needles among intravenous drug users. 22. A 53-year-old male patient is admitted in the gastrointestinal ward due to a newly diagnosed type 2 diabetes mellitus. Upon initial assessment, the nurse should expect all of the following symptoms, except A. Increased urination. B. Dry mouth. C. Hypoglycemia. D. Increased appetite. Answer. C. Hypoglycemia. Rationale. The common symptoms of diabetes mellitus are the 3 Ps, polyuria, increased urination, polydipsia, increased thirst, causing dry mouth, and polyphagia, increased appetite. Hypoglycemia is not expected on a newly diagnosed type 2 diabetes. It can be expected if the diabetic patient has been taking a diabetes medication or insulin therapy. 23. Mr. Smith has been coming to the diabetes clinic over the past 3 months to have his glycosylated hemoglobin HbA1c test done. He asks the nurse, "How will I know if I am pre-diabetic?" The nurse responds that prediabetes is diagnosed at which range of A. 5 to 5.5%, B. 6.5 to 7%, C. greater than 6.5%, D. 5.7 to 6.4%. Answer: D. 5.7 to 6.4%. Rationale: a level between 5.7% and 6.4% is considered prediabetes. Diabetes is diagnosed if the levels are over 6.5%. The normal value of HbA1c level is less than 5.6%. 24. A patient is admitted in the urology unit and is diagnosed with acute pyelonephritis. Which of the following symptoms support this diagnosis? A. Chills and costovertebral angle tenderness. B. Polyuria and nocturia. C. Burning sensation upon urination. D. Jaundice and flank pain. Answer: A. Chills and costovertebral angle tenderness. Rational: acute pyelonephritis is a condition that causes kidney inflammation. It is a bacterial infection that exhibits symptoms of chills, costovertebral angle tenderness, flank pain, fever, nausea and vomiting, and increased urinary urgency and frequency. Nocturnal polyuria is more common in patients with decreased bladder capacity such as elderly clients. Lower urinary tract infections, UTI, usually manifest as a burning sensation upon urination. Jaundice commonly results from liver or gallbladder obstruction. 25. A 30-year-old male client who works as an electrician is rushed into the emergency room following a severe burn injury. The patient has the following vital signs: heart rate 142 beats per minute, blood pressure 68/45, respiratory rate 24 breaths per minute. His pedal pulses are difficult to find and he appears pale in color. The nurse immediately performs which of the following actions first? A. Obtain an electrocardiogram, ECG. B. Collect blood for complete blood count, CBC. C. Use a Doppler device to assess pulses. D. Commence intravenous fluids. Answer: D. Commence intravenous fluids. Rationale: clients with serious injuries due to severe burn accidents are at high risk of death due to hypovolemic shock. This is evidenced by the low blood pressure level of the patient in this scenario. Therefore, the first nursing action is to start intravenous fluid therapy. Options B, C, and D are also important nursing actions for this burn patient, but reversing or preventing hypovolemic shock takes first priority.